Hey, hello everybody. Happy afternoon. This is Dr. Ken Munich. This is Dr. Ken Munich. Sorry about that. Still working on the video program here. We've got a very interesting subject today because a lot of the symptoms, not all of them, okay, first of all, but a lot of symptoms are similar to the fibromyalgia that we've talked about so much before. We're talking about reflex sympathetic dystrophy, also known as complex regional pain syndrome, or type 1 or type 2 RSD. So the symptomatology is not the same as fibromyalgia, but my goodness, the diagnosis and so forth are just as difficult for the differentiation between other conditions and this complex regional pain syndrome, also known as the suicide disease, because of the level of pain that's involved in it. So let's take a look at this now. This is a condition that is activated by some tissue injury with or without related nerve damage, which means that you had some tissue damage, so forth and so on, but the reaction that people have is much greater than the actual injury itself. So what happens is, say, for example, you slip and fall, but the pain level is much, much greater than that which you would normally find on a slip or a fall, and it stays that way. It could start, say, for example, in the shoulder. By the way, shoulders, elbows, hips, so forth are the most common areas that it starts with, as a matter of fact. And what happens is that this pain level is extreme, and it doesn't go away. And it goes from, say, for example, the shoulder to actually all body parts. It can actually just go through everything. And so the pain is very, very difficult to actually explain for patients, to the point where it affects all their body aspects in itself. You have some swelling and some redness, possibly blue skin, a variety of different things that actually take place in a situation like this. So symptoms can start slowly, but they can also start aggressively. There's oftentimes no rhyme or reason. You have different nervous systems. It is thought initially in my research of this condition that it starts with the peripheral nervous system. That's peripheral means those things that are at the distal ends, say, for example, or those things that are nearest the skin, whatever you might say. Of course, there's other nerve names, but let's say, for example, you close your finger in a door. That peripheral nerve then goes to the spinal cord. Spinal cord goes to the brain, and the brain immediately sends signals down to your finger that you have pain. And so what happens is it's faster than a blink of an eye. Anybody that's ever had any injuries, conditions, you know what we're talking about over here. It's that fast. Bingo. You hurt yourself, and then all of a sudden you have this severe pain, throbbing, so forth and so on. Well, the sympathetic nervous system is another name. So we went from peripheral nervous system to, or peripheral nerves, to the spinal cord to the brain. The sympathetic nervous system, you have so many different types of systems in your body, actually regulates blood flow and also heart rate and blood pressure, so forth and so on. So when this happens, the sympathetic nervous system, especially if there's an injury where there is actual tissue damage, will actually constrict the blood vessels in that area. And the constricted blood vessels will stop your body from bleeding out, so to speak. It'll minimize the amount of blood that is lost, that constriction. Keep in mind, you have constriction, dilation. Constriction is where you actually tighten things up. Dilation is where you kind of open things. Well, this is where you actually constrict the blood vessels in that area, so there's not a lot of excess, shall we say, blood loss. So what happens is that just like an injury, you have that throbbing, you have that severe pain, so forth and so on. But what happens is it starts to calm down, calm down. The body is already healing that area, so forth and so on. Well, in this condition, complex regional pain syndrome, or RSD, or whatever names that you want to use, the body doesn't release the sympathetic nervous system. It holds on to it. It holds on. It does not allow the blood vessels and so forth to relax. Consequently, have a blood backup, so to speak. Look, if I were to take my finger again and I were to squeeze down on it, almost immediately that finger is going to start turning red and further red, like it is now. I don't know if you can tell or not. If I continue that, that finger is going to start to throb and then swell up and change all sorts of different colors, and the sensitivity and everything else is going to be gone. That's what happens as far as the RSD is concerned, where the body is not sending out normal functional symptoms. They think it might be a central nervous system evolvement. The problem with this condition is that the answer has not been found yet, okay? And that diagnosing this is just like fibromyalgia. You listen to the history and the patient, because the conditions or the tests are really not ones that you could depend upon to actually diagnose this condition. How interesting. Isn't that interesting that you have something very, very similar to this? So the diagnosis is difficult in itself, it's primarily involved with the amount of pain, the type of injury, and the amount of pain, and where it started and where it is now. Very, very interesting. There is no answer as far as a cure, I'm sorry to say. What happens is that the doctors have done a number of different tests and evaluations to find out what would be the best way to actually treat this. Obviously, one of the things is medication, but when you talk about medication, you're talking again about the strongest things, heroin, opioids, things of this sort, but then you have an addictive problem. You're also talking about, they suggested physical therapy, but they found out that that doesn't really work either. They talk about a variety of different things that you could use as far as treatment is concerned. But for the most part, the most important thing is the early diagnosis of this condition and the fast, quick response of treatment, whatever you might put on this. And oftentimes that will actually alleviate this. The longer you have the problem, it becomes chronic, then the pain just very, very infrequently will ever be controlled or go away. So that's a real problem in itself. So what you have is you have a problem with this overall evaluation of the symptomatology, the diagnosis, trying to make it as quickly as you can, and to actually try to do something as far as the treatment in itself. The treatments that I read about involved a variety of different things, like I say, but none of them have really been validated as far as proving that it would work. So what you have a problem with here is the actual treatment. And matter of fact, many of the doctors still say, in evaluation say, that there is no real cure for this. However, in some instances, it recedes for no apparent reason. The body all of a sudden just lets go and you start feeling normal. However, it also can return in many cases. And when it does, you have that same problem again. And oftentimes you really don't know what you did to actually improve it or help it as far as the treatment in itself. The reason why they call this a suicide disease is that some people actually do commit suicide. But another thing that they strongly suggest, believe it or not, in the most aggressive of forms, is amputation of whatever limb that is the most painful. But then they obviously have a problem with phantom pain, which might not ever go away again, and you just add it on to your problem. The symptoms, as I mentioned, can be swelling, redness. You can have a variety of different symptoms that actually are causing a reaction. I'm going to take a look sideways because somebody just said something in here. Excuse me. I have to read this because I can't read it sideways. Okay, hi, Doc. It's Debbie from Yucca Valley, California. My fibromyalgia is still here. It's affecting my feet and legs now. Okay. Okay. We'll talk to you about that. And you have a difference between fibromyalgia and this RSD problem. The fibromyalgia is, again, all over the body, but it doesn't have the aggressive swelling and the amount of pain that is greater than the trauma itself. The vast majority of patients that have this RSD are because of a tissue injury, not just because of the evaluation of the fibromyalgia itself. But there's a lot of similarities, which is very, very frustrating. Symptoms often develop slowly. Think like osteoarthritis that develops, or even fibromyalgia that develops over a period of time that is kind of sneaky. You have pain, you have aching, burning, cold, deep, throbbing pain. Some of those things are the same things that fibromyalgia patients have. Diagnosis by physical exam and history, and what the symptomatology is, how long you've had it, and so forth. So all of those things are really important as far as the differentiation and diagnosis between one condition and the other. I find that the reflex sympathetic dystrophy is not the same as fibromyalgia, based upon my readings and understanding as far as research is concerned. Again, you have the sympathetic nervous system probably involved, along with the central nervous system that is sending out abnormal signals. You have something called allodynia, again, which is pain that is with no noxious stimuli. No one hit you, no one touched you, nobody did anything to you, and yet all of a sudden you have these jolting pains, throbbing pains. But there are a lot of similarities. Again, sometimes cold hands and feet. You can have throbbing pain. You can have burning pain. You can have pain all over the body. You can have various other symptoms that have similarities between RSD and fibromyalgia, but I am confident in understanding that the fibromyalgia and RSD are different, and yet just like one of the many conditions, MS, OA, rheumatoid arthritis, a number of different ones that have similar symptoms that appear to cross over, and that's a real shame. But we know, based upon our work with fibromyalgia, that our program works with the condition, and we've seen a tremendous number of positive responses from patients that get into our program and stay on it. Whereas for RSD or this complex regional pain syndrome, there is no cure, and it may just automatically disappear, but it comes back quite often for no apparent reason. Another similarity is this is more common with women than men. It occurs most often between the ages of 30 and 60. And so those are some, again, women a similarity, but as far as fibro is concerned, fibromyalgia starts actually because of the genetics. It actually starts right at the beginning of birth, but it's misdiagnosed. It's not diagnosed properly. Again, there's no single test for RSD, just like there's no single test for fibromyalgia. And so the idea is to try to, it appears with RSD, they're trying to treat the symptoms itself, the swelling, the redness, the inflammation, the pain, all those things that a person has. Whereas with our protocol with fibromyalgia, we are actually treating the condition. We actually have a protocol that works from the beginning, that works right away into the condition itself, and that takes care of the symptoms. So although there's a lot of similarities between the two, reflex sympathetic dystrophy or complex regional pain syndrome, or type 1, type 2, so forth, are similar as far as the symptoms are concerned as far as fibromyalgia, but definitely different as far as the degree of pain and as to whether or not there is a treatment, a viable treatment for this condition. Fibromyalgia, we find there is a viable treatment. We're working with the condition itself, with the many, many patients that we've helped, whereas the RSD has no definitive answer for the condition itself, and so people have to suffer with it in horrific pain, that's for sure. Anyway, this is Dr. Ken Muich, Fibromyalgia Wellness Center, Stetson Chiropractic Clinic. And this next week, I'm sorry to say, I will not be on Monday at 12:30 because I will be in transit. I have to go to a convention, and when I'm coming back, it's exactly at the same time that I usually have this presentation. So this next week, I will not be on, but I'll be sending information out to you as far as the next topic is concerned. But in the meantime, I will thank you very, very much for your support and your belief. And I will be checking with, Debbie from Yucca and talking to her about her fibromyalgia. Take care, everybody. Hope all is well. Have a wonderful week. This is not sunny Scottsdale. We're having a lot of rain and cold weather, and up north there's a lot of snow. So we're just going to muddle through it and make sure everything's taken care of. In the meantime, again, we will see you not next week, but 2 weeks from now. But I'll be in touch with you, letting you know what the subject is and carrying a variety of different things and topics in itself. Thank you so very, very much. Have a wonderful week or two, and I will talk to you about the convention and what I found. Thank you very, very much. Bye-bye now.